Hey class, welcome to another assessment. This week we're going to be on our anesthesia turnover and setup assessment. Now with this assessment, you will have no help. Basically, you're going to use the assessment sheet as well as this video to guide you on the steps and the directions of the assessment. So without further ado, let's get started. So the first thing you're going to do is you're going to come to the sink. I'm going to give you your soap and you're going to wash your hands for 30 seconds. So we're going to do that, and once we're complete, we're going to go ahead and start our day in the operating room. So welcome to our OR, and this is where you're going to don all of your PPE. So you're going to grab a mask. You will grab a bouffant cover for your hair. And then you will grab your gloves, small, medium, large, whatever size you are. You're gonna put your PPE on, and then we're gonna go ahead and start our anesthesia day. So basically, since we're facilitating an anesthesia turnover, we're basically going to look exactly like this. So after the patient is transferred, you're gonna have to facilitate that turnover. Now everything's gonna be strewn about. There's gonna be cords and cables on the floor. There's not gonna be a circuit. There's not gonna be a suction. Most of the time, EVS will take that stuff off for you, but sometimes they won't. So we'll just facilitate, there's nothing there. So the first thing we're gonna do is we're gonna go ahead and take our cabbie wipes. And what you're gonna do is you're gonna take it out. I don't have gloves on, so I'm not gonna wipe it down, but we're just gonna visualize. So what you're gonna do is you're gonna take your cables, put it on the IV pole. We're gonna take our pulse ox, clean it, put it on our IV pole. We're gonna take our EKG, make sure it's clean, make sure you get all the actual leads. Put it on the IV pole. We're gonna take our temperature cable, clean, put it on the IV pole. Now there's no specific order, but that's exactly how I want it. So after that, we're gonna come over here, and then we're gonna take our cabbie wipe, pull it out, and we're gonna clean the machine top to bottom, left to right. So we're gonna go from top to bottom, and we're going left to right. Making sure we get all the dials, the knobs, the surface areas. Make sure you get the APL valve, the vent selector switch, pretty much anywhere the anesthesiologist touches, because we want to make sure we're not going to cross-contaminate anything. We want to make sure it's clean for the next patient's use. So you want to get all of our screen, our little toggle button is here, down here, all our drawers, and everywhere here. And last but not least, down there. So now that that's done, we can go ahead and throw on our new equipment. So in the operating room, you're gonna have a bag, it's gonna have the circuit on it. So we're just gonna facilitate, we already opened that bag. So we got our circuit. Then we're going over here to our suction. We're gonna grab a new suction because it had some blood in there or whatever the case may be. Mind you, blood goes in the biohazard bin if there's blood in the suction. If it's regular suction, it just gets thrown away. Bam. We're good to go. We're reset for the next patient, and the next patient can roll in. Now, what did I explain before has to be done before a new patient comes in? A circuit leak check. So we have to perform a circuit leak check because we gotta make sure that there's no leaks before the patient gets on the ventilator. So what you're gonna do, put that in there. Now we don't have any oxygen running, so I can't really run it, but we're gonna hit circuit leak, and then you would just go through the parameters that we've been going through the last couple of weeks, and you will perform the circuit leak check. Once that passes, I'm going to ask you to perform an anesthesia setup based on the age that I give you. So basically, for example, say I just want a regular setup for a 10-year-old. So you would go down to 10-year-old, where it says 10 to 12. and then you would grab 2 tubes. So it says 3, but you can grab 2. So you would need a 5560, and then I would have to have you grab a blade. So the blade is a Miller 2 or a Mac 2. You're only gonna grab one. You don't have to grab both, just grab one. Either you're gonna grab a Miller 2 or a Mac 3. And up here, if it says 1.5 or a 2 Miller, 2 Mac, you can just grab one or the other. So you can just grab a 1.5 and that's it, or a 2. And then, or you can just grab a Mac 2, one or the other. Then you would choose your mask. So with the 10-year-old, it's gonna be a child. And then oral airway, you're gonna have to grab a 7 and an 8. So you're gonna have to grab 2 oral airways. And then you would grab the corresponding BP cuff, which would be a small adult. Once you would get that set up, you're gonna go ahead, boom. Put your green towel down. Grab the 2 tubes that are on the sheet that I told you to grab. So you have your tubes, your endotracheal tubes. Bonus points if you grab the stylet for the actual endotracheal tube. You're gonna grab the 2 oral airways that I said to grab, whichever ones are corresponding to the chart. Your laryngoscope handle and blade. Your mask. Oh, sorry. And then you're gonna grab your BP cuff. Last but not least, the last thing you're gonna do is you wanna take your monitors. So you want to put your SpO2 probe on the monitor. So it's ready to go. And then you're going to put the leads onto your EKG cable. Now, I won't be telling you all this stuff. You're gonna have to memorize it. So you're gonna have to keep looking at the video, or you're gonna have to look at the assessment sheet. It's really, really easy, but like I said, we're just gonna basically go over what we went over last week, which is going to be our anesthesia turnover and then the setup. If you have any questions, please feel free to email me. But other than that, good luck, and I'll see you guys next week.